de faire ces choses-là, de faire un gift, des books qu'il lui-même y a écrit. Je lui donne ça à un médecin qui est capable de faire. Je nous ai un grand merci pour ça. Ambassador by our Dr. Balaji, the top officials of my ministry, doctors, good morning to everybody. Today we gather at National Cancer Center to mark the World Cancer Day, a day of unity, action and hope. On this day, we acknowledge the resilience of those affected by cancer, celebrate the collective efforts to combat the disease, and reaffirm our commitment to improving cancer care. The theme for this year's World Cancer Day, United by Unique, highlights the importance of placing people at the center of care and ensuring that their stories are at the heart of the conversation. This aligns perfectly with my unwavering commitment to fostering a patient-focused healthcare system, a vision that has guided my actions since the very first day I assumed office in this ministry. Under the leadership of our Prime Minister, Dr. Naveen Ramgoolam, we are strengthening our healthcare system to ensure that every patient receives the care they deserve with dignity and compassion. Every individual who faces cancer has unique needs, unique perspectives, and a unique story. Yet people touched by cancer are united in a shared ambition to lower the cancer burden and to lead better lives with cancer. In 2025, we saw a rise in cancer diagnosis. Among males, 1,205 new cases were reported, with prostate and colorectal cancers being the most common. Among females, 1,636 new cases were diagnosed, with breast and colorectal cancers being the most prevalent. Unfortunately, cancer cases have been steadily increasing over the years, with females now being diagnosed more frequently than males. In 2023 alone, 1,546 deaths were attributed to cancer, 754 males and 791 females. Prostate cancer was the leading cause of death among men, while breast cancer claimed the most lives among women. These statistics are a stark reminder of the need for continued efforts to fight cancer and improve care. I am pleased to announce the on-course surgery services will now be available at the National Cancer Center, with on-course surgeons coming from India to perform surgeries in our newly functional operational theatre. Additionally, we have revived our palliative care services to ensure that individuals receive the best possible care no matter where they are in the journey against cancer. To make cancer care more accessible, we have partnered with the CNT, introducing new birth foods from Cupip and Catobone to National Cancer Center. This will ensure that patients have better access to our services, while plans are also in place to provide public parking soon. Our vision is to transform the National Care Center into a multi-speciality hospital where patients can benefit from a wide range of services all in one place. As we move forward, we remain united in our commitment to improving cancer care and outcomes for all. Today, let's honor the stories of those who we have lost, stand in solidarity with those still fighting, and continue our work towards a world where cancer is no longer a source of fear, but one of hope. At the same time, I would like to thank the ambassador who is in front of us, and he has been of great help, and there has been a massive contribution from Saudi Arabia for the construction of this building and for its equipment as well. So from the bottom of my heart and on behalf of the government of Mauritius, on my own behalf, Excellency, I thank you for all the efforts you have made in order that we can have such an interesting building, and where we have started as from today all the important surgeries related to cancer. We had all the time been sending our patients to India, but now I do hope that most of the work can be done here. And again, I would like from the bottom of my heart to thank India in particular, Dr. Balaji, who is here. And after Dr. Balaji, we have got other two great onco surgeons who are coming. On 12 February, Professor Durai Swami and Professor Balaji Ramani also. They are joining the group. And I really thank the government of India, the people of India, for the support that you are extending to us in different fields, particularly in health. And I do hope that you are going to get the maximum benefits out of what you are offering to us. And I do hope that our patients also will be at least feel more comfortable when such surgeries are performed here. Je tenir à remercier surtout l'ambassade pour contribution qui finit apporter pour nous capables de gagner aujourd'hui un bâtiment moderne avec ce bon équipement. Jusqu'à là, pas une grande opération, pas de faire presque du tout ici, mais là, nous pouvons commencer et nous te donnons une parole que l'opération cancer, pour bien faire dans Maurice, même l'opération qui est bien compliquée, parce que comme d'habitude, nous gagnons si beau des côtés l'aile et des petites tenailles, un professeur qui est présent devant nous, le professeur Balaji, et après, il faut une info des professeurs qui vont venir, et ça, il faut continuer, il faut aller même. Faut espérer avec tout ce que le gouvernement peut mettre à disposition des patients qui souffrent d'un cancer. Il ne faut pas plus dire que nous sommes capables d'éliminer, mais nous devons faire tout ce qui est humainement possible pour faire confortable, qui est capable, parce que nous prenons une maladie là, puis maladie était, et comme là, maintenant, il commence ça va de l'opération là, et nous espérons ne pas pour 10 ans envoyer les autres en dehors pour traitement. Il y en a beaucoup, presque 3-4 par semaine qui a fait traitement en dehors. Et quand traitement là, il y avait des bulles dans Maurice, beaucoup plus confortable, et les mêmes parents aussi pour se sentir beaucoup plus en sécurité. Donc, c'est quelques mots encore une fois, mon remercie de l'ambassadeur, et I would like to, if you can add a few words today.
Well, much really great to be back to Your Excellency. I hope this center provide the highest standard of healthcare for cancer patients, and also I hope that this center enhancing the health system in Mauritius. In Saudi Arabia, we are very honored to cooperate with the Mauritian to provide such this project. Thank you.
Thank you. And Dr. Balaji.
First of all, I would like to thank our Honorable Minister for extending invitation for me to come here. Thank you, Minister, sir. Also, I would like to thank our Excellency, the Ambassador of Saudi Arabia, for supporting this hospital project. And I would like to thank our Principal Secretary, Dr. Dina Singh, the Director, and Dr. Yan Ramdeen and Muni Krishna, the Head of the Department of Plastic. Thank you for all your support. Today being the World Cancer Day, and most of the cancer can be preventable when detected early. Suppose you take, your food habits and your stop alcohol, stop smoking. Because there are so many habits of smoking. There's called reverse smoking. Some, in India, our brother and, we are Indians mostly. And what happened, that is why we have a natural alliance and we support our government. That they reverse smoking, they burn the mouth and it goes through the palate to the brain. So women, they are afraid of the husband, they smoke, the reverse smoking. That's a very dangerous one. So like this, the habits, if you have a good habit, the cancer can be prevented. 90% of the cancer can be. Only 10% we need support. So here we have created a good system of discipline now. Even if I am not there, our surgeons here they can operate. So, the first case, our Honorable Minister has requested me to do the first surgery here. I am going to do a cancer tongue, the neck dissection and reconstruction. And I met the patient and see, he is not aware of it. The patient is not, it's grown big. Half of the tongue is involving. That means he is not aware. So we have to educate the patient for prevention. Today being why do we celebrate Cancer Day? It's not a celebrating day. We have joined together to celebrate the success. We bring the technology together. So what is not available here? We have people, we have manpower, we have facility. Thank His Excellency, the Ambassador, for the great support of this hospital. So we need all of us to work together to prevent cancer and save our patients. Thank you, Minister. Thank you.